The coronavirus is a family of viruses that cause illnesses ranging from a cold to more severe diseases such as severe acute respiratory syndrome (SARS) and Middle East Respiratory Syndrome (MERS). A new coronavirus has broken out in the Chinese city of Wuhan, currently named novel coronavirus 2019 nCoV. A seafood market in Wuhan, China, thought to be the source of the new coronavirus outbreak. At least 106 people have died in China and infected more than 4,520 globally, most of them in China. And death toll continues to rise. The name of coronavirus comes from its crown-like shape. Sometimes, but not often, a coronavirus can infect both animals and humans. Most coronaviruses spread the same way other cold-causing viruses do. Through infected people coughing and sneezing. By touching an infected person's hands or face. Or by touching things such as doorknobs that infected people have touched. According to the WHO, signs of infection include sneezing, cough, sore throat, runny nose, fever, shortness of breath and breathing difficulties. The virus responsible can be diagnosed by taking a sample of respiratory fluids, such as mucus from the nose, or blood. The test results wouldn't change how you treat your symptoms, which typically go away in a few days. But if a coronavirus infection spreads to the lower respiratory tract, your windpipe and your lungs, it can lead to pneumonia, severe acute respiratory syndrome, kidney failure and even death. There is no vaccine for coronavirus. So treatments include taking care of yourself like the same way you treat a cold. Drink enough water. Get plenty of rest. Take over-the-counter medicine to reduce pain and fever. To help prevent a coronavirus infection, do the same things you do to avoid the common cold. Avoid close contact with people who are infected. Wash your hands thoroughly with soap and warm water or with an hand sanitizer. Keep your hands and fingers away from your eyes, nose, and mouth. Do not share your towels, soap or household items like cups with people who are infected or you suspect they might be affected. The consumption of raw or undercooked animal products should be avoided. Raw meat, milk or animal organs should be handled with care, to avoid cross-contamination with uncooked foods. When visiting live markets, avoid direct unprotected contact with live animals and surfaces in contact with animals. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue, throw tissue away immediately and wash hands. You should seek medical care if you experience any of these symptoms. Remember, coronavirus can spread in the same way as the common cold or flu.